According to the CDC, more than 30 million Americans are diagnosed with diabetes, and 84 million have prediabetes, which, once diagnosed, could lead to development of diabetes within 5 years. Since diabetes is so prevalent, there is a wealth of information related to managing blood sugar and improving diabetes control. We're going to explore some of these misconceptions. All carbohydrates provide energy to fuel our metabolic needs throughout the day, but some are better than others. The digestion and glucose absorption rate varies depending on the type of the carbohydrate consumed. Whole grains, for example, have vitamins and minerals and the biggest impact on our blood sugar control because they contain fiber, and that delays glucose absorption and action. Unfortunately, the processed grains, such as white breads, white rice, white pasta, crackers, cereals, they have low nutrient density and promote a spike in blood sugar when consumed. Other carbohydrates, such as the dairy sources of milk and yogurt, contain protein as well as carbs, which can also help delay absorption and manage blood sugar over time. All sources of fruit contain vitamins and minerals and fiber, but fresh fruits are higher in that nutrient-dense composition, while the canned, dried, and fruit juice often have added sugars and low fiber, which can result in faster blood glucose spikes in absorption. Foods affecting blood sugar the fastest are simple sugars such as honey, sugar, candy, and sweet treats. They're digested quickly, so frequent consumption and corresponding spikes in blood sugar over time can have a negative impact on your long-term glucose management. A common misconception with blood sugar management and diabetes is the need to avoid rice, pasta, and potatoes. If the optimal sources of those are chosen, such as whole grains, potatoes consumed with the peel, and vegetables cooked without butter or extra fat, they contain essential nutrients and fiber, which can help aid in satiety, which prolongs digestion and also helps in regularity. Serving sizes, though, are very important. 1/3 of a cup of cooked pasta or rice is considered a serving. So one cup of cooked pasta may fit well in a meal pattern. You still do need to watch overall portions. One slice of bread or 1 6-inch soft shell tortilla is another example of one serving. A small potato the size of a woman's fist, or half of a corn cob, even half a cup of cooked peas, potato, even legumes like pinto, garbanzo, black, and kidney beans are all another example of nutrient-dense sources of carbohydrates, but the portions to manage. All individuals should consume a variety of carbohydrate sources, complemented with lean proteins and healthy fats for optimal diet and wellness. Recommendations for carbohydrate goals will vary from person to person. Always meet with a registered dietitian to determine and address your specific needs. For example, while 150 to 200 grams of carbohydrates consumed total throughout the day may be a general guideline, individual needs can vary depending on activity level, weight, height, sex, age, and the history of blood sugar management. It's important to note that the total carbohydrates should also be distributed based on the frequency of intake, the person's schedule, size of the meals, and their personal blood sugar results. For example, a recommendation of 45 to 60 grams of carbohydrates eaten at every single meal may not be realistic based on someone's schedule or hunger levels. Maybe incorporating snacks or small frequent meals would work best. A consistent carbohydrate diet is key for everyone. Every 4 to 5 hours, we use up those carbohydrate stores from food. By eating evenly spaced meals, it can prevent and manage spikes in blood sugar levels. Treating hypoglycemia or low blood sugar with protein sources is another common mistake in diabetes management. Protein intake can enhance or increase the insulin response, delaying the effect of the dietary carbohydrate to raise blood sugar levels. Even the use of carbohydrate sources that include protein, such as milk and granola bars, to treat a hypoglycemic reaction should be avoided because of the concurrent rise in insulin that can occur. Always manage low blood sugar reactions with the rule of 15. Check blood glucose level with the glucometer. If the level is under 70 milligrams per deciliter on that glucometer, consume 15 grams of carbohydrate and then wait about 15 minutes and check again. Examples of 15 grams of carbohydrate options are 1/2 a cup of fruit juice, some sugar candy such as jelly beans or a tablespoon of honey, And also avoid protein sources for optimal blood sugar absorption so that those carbohydrates that are pure can enter the bloodstream right away. Avoiding desserts and sweets with diabetes is yet another common misconception. Delicious treats are often readily available at celebrations and possibly on your coworker's desk. Managing carbohydrate intake is more important than avoiding all sources. Be intentional. Incorporate a variety of foods, including proteins and healthy fats, prior to sweets to balance blood sugar management. And always be aware of portions. One 15-gram carbohydrate serving of sweets is equal to, say, 1 inch by 1 inch square slice of frosted birthday cake, or a 2 inch by 2 inch square of unfrosted brownie, or also 1 tablespoon of sugar, syrup, or honey. While the same amount of 15 grams of carbohydrate is found in 1 medium apple, or half a corn on the cob, 1 slice of bread, 1 cup of milk. So remember the nutrient quality and density, but also the flavor when you're choosing your items. Remember that 45 to 60 gram carbohydrate meal. Choosing servings wisely that can balance your carbohydrate choices are the best way to make all foods fit. Non-nutritive sweeteners may be free of calories, but not free of concern. These additives have been linked to a variety of health issues, including interrupting the good bacteria in the gut, increasing food cravings. If we become accustomed to that overly sweet taste, we may not appreciate fresh strawberries or the nuanced flavors in steamed carrots. Also, studies have shown artificial sweeteners can elicit an insulin response, which increases the amount of insulin circulating in the blood, and that can prompt the storage of body fat. There can be benefits to artificial sweeteners, though. If sugar-sweetened beverages are frequently consumed, artificial sweeteners can be a short-term replacement strategy. Ideally, aim to decrease both sweetened and non-nutritive sweetened beverages and instead use other alternatives such as herbal teas, fruit-infused, or ultimately plain water. Focus beyond food. There are a variety of things that affect blood sugar management. Stress over time can elevate blood sugar, as well as poor sleep. Physical activity done after the intake of carbohydrate-containing foods and meals can actually help to digest and lower that subsequent blood sugar reaction. Sickness, your body can elevate or decrease the blood sugar level depending on the type and longevity of the illness. So have a plan in advance to make sure that you're still taking the medication and treating your blood sugar properly. And use that glucometer. Test your blood sugar, ideally first thing in the morning, but also throughout the days. If you're feeling a little different, check to see if your blood sugar is part of the reason. There is extensive research related to diabetes management. Navigating and applying the information can be a challenge. Information may be filtered through family, friends, and coworkers, and every individual's own experiences will shape their needs. When it comes to your health and well-being, be your own patient advocate. Ask questions, challenge comments and information so you can make informed choices. And here are a few examples where I found some of my research today. Thank you for watching this video. Don't forget those free nutrition consultations with Sarah and myself. All employees, dependents, and retirees have this great benefit at their disposal. We really look forward to meeting you. Contact us today.